they couldn't attend. And so today's meeting is all about this challenge that all of us are engaged with. We have telehealth equipment at our libraries, whether it's a digital privacy booth or a computer in a room with some other healthcare type devices, or maybe it's just a hotspot kit with a laptop. Whatever it is, we are all invested in how do we get people to come and use what we have. And also the challenge is ensuring people who can benefit from these services the most are aware that they exist, that they're free, they're open to all, regardless of income, that they can improve everybody's access to quality health care, and that they can make receiving medical care much more convenient for everyone, whether they have transportation issues, mobility, or economic or health challenges. So with that, I just want to say, for anyone who doesn't know, my name is Stacy Wixall. I direct the Macedon Public Library, and we do have a digital privacy booth that I targeted at telehealth. We were awarded it because RLC received a grant, and I was super excited about that opportunity to have a booth like this and to target it at healthcare. But I've been a little bit disappointed because it doesn't always mean because you build it, they will come. Takes a little more work, and that's, what my mission is with having this forum is to, put the work in, and hopefully the people will come, and that it will help to improve health equity for everyone. So today we have a couple of speakers on board. The first speaker is Jordan Yaros. Jordan joined the Southern Tier Healthcare System as a program coordinator in 2021. Her duties include coordination of the Moving Forward Together initiative. It's a partnership with CARES ACASA, Clarity Wellness Community, and the Cattaraugus County Department of Community Services that works to increase access to internet services in Cattaraugus and Allegheny counties to allow for individuals in treatment for substance use disorder to access telehealth counseling services essential for their recovery. Jordan holds a Bachelor of Science degree in biology from the University of Pittsburgh at Bradford. Today, she's going to detail her experiences promoting telehealth. And I just want to say that I heard her presentation last month. She did one for us, and we asked her to come back because she's done a lot of really inspiring things, and I think you can get some really good ideas from her. So welcome, Jordan, and round of applause, silent applause.
Thank you for that introduction. I'm going to share my screen because I do have a little PowerPoint to go along with this. Let's see here. Okay, can everyone see my screen? Okay, perfect. Okay, so like she said, I'm Jordan Yaros. I'm a program coordinator with Southern Tier Healthcare System. So I know most of you are like library directors or involved with libraries. What we do is we work with libraries and have implemented telehealth equipment into libraries. And there's one community-based organization that I'll get to in a second. Yeah, so, and we've also expanded from substance use disorder to all of healthcare. So this is primary care, well visits, counseling, things like that. So it has expanded since we initially started this with substance use disorder and partnering with those organizations. Yeah, so I'll talk a little bit about what Southern Tier Healthcare System is, just to kind of give you guys an idea. So we are headquartered in Olean, New York, and we improve the health and wellness needs of the rural communities that we serve. So we serve Allegheny, Cattaraugus, and Chautauqua counties. And we work with our collaborating organizations to develop and implement programs to remove those barriers to healthcare. So one of the programs is our Moving Forward Together program. which is the telehealth rooms at 5 different sites. Some other notable programs that we have are our Safe Kids program, which is child injury prevention. We have an overdose prevention program. We have a workforce development program, healthcare workforce development program, and we also have a caregiver navigation program, insurance navigation. So those are some of the things that we do here at Southern Tier Healthcare System. And then this is what one of our telehealth rooms look like. So I know you probably are all familiar with what a telehealth room is. I know we probably all have like different levels of what we consider a telehealth room or telehealth equipment. I know you guys spoke about like hotspots or like a booth. So we actually have rooms that are dedicated and basically a computer on wheels. This is. So it's got a nice screen, nice camera. There's headphones for privacy. There's white noise sound machines for privacy as well. And this type of equipment can be moved from room to room. And the room could be decided by the organization that the equipment is in. So it could be the boardroom, it could be the community room, could be, a little empty closet or similar, just as long as it's private and the door can close, there's no like windows or anything like that. Goes into a little bit more detail about what exactly we purchased for all of our locations. Yeah, so it's kind of like a little overview. The picture on the left was what was drawn up, and then the picture on the right is actually what came to life with these. So these are our telehealth room locations. We have 2 in Cattaraugus County and 3 in Allegheny County. Yeah, so we're also expanding. We're adding one in Cattaraugus County and another one in Allegheny County soon, hopefully by the first of the year. And like I said, most of these are libraries, with the exception of Healthy Community Alliance, which is an organization kind of similar to us. They're just like a community-based organization with programs for the community. So when we were initially like thinking of this idea, so basically this is a map, and all of the areas in red are areas that lacked internet connection or cellular service as well. So being in these are both Cattaraugus and Allegheny counties in New York, being that this area, lacks those things, the internet connection, the cellular service, we tried to focus our locations as best we could close to those locations that had lacking internet connection and lacking cellular service. So that's kind of how this came about and how we chose our locations to implement the equipment. And I think we've got a good spread across 2 counties that this project covers. I know this was talked a little bit about in the introduction about who would benefit from telehealth in the telehealth rooms that we have. And this could be anyone that lacks the necessary technology and internet connection for telehealth. Maybe they need a private space as well. Maybe they have, kids at home, or they live in a house where there's multiple people and they just can't get away to have a private session with their provider or doctor, therapist. Maybe they don't have the transportation to get to their appointments. I know we live in 2 rural, or we cover 3 rural counties. So a lot of people don't have transportation, and there's transportation issues getting to and from appointments, and maybe they have appointments, out of town that they aren't able to make. Or maybe they find technology daunting and navigating that daunting. So yeah, so that's some of the people who benefit. And so how someone would go about reserving one of our 5 telehealth rooms is either by phone, and that would be by calling our office, and I can help them reserve. It could also be through the libraries or the telehealth locations. They could also reserve one for them, or it could be online, which I'll go into detail about that shortly, our online reservation form and how to fill that out. So some of the marketing things, this is actually an example of some of the marketing that we put out with a QR code, all of our locations, why you would use a telesuite or a telehealth room. I guess I use those interchangeably, but they mean the same thing, a telesuite, telehealth room. Yeah, so we did flyers, social media posts, and those flyers and social media posts were for us, for our partnering organizations to put out, and also for our telehealth room locations. We did press releases. I did provider education. So I went in and joined their staff meetings at some of these locations and kind of promoted the availability of the telesuite, and encouraged them to think about, you know, who might benefit, because they know their patients the best. And also there's also a trust factor with telehealth too. So hearing it from me and kind of an outside organization might not be as trustworthy as hearing it from your actual provider. So that's kind of what we really wanted to push hard was, you know, make sure you're educating your clients or patients that this is available, basically. We also put some things out in the school's newsletters, and then we do table at community events. So we would set up and have stuff for our other programs, and then also little flyers and information about our telehealth locations. So those are some of the kind of things we've done. I don't think that captures it all, but those are some of the things that I just wanted to highlight. So our website. So I am going to go right on our website. All right, can everyone see the website? Okay, perfect. So this is the page, a couple pages on our website, I guess a tab on our website for telehealth and our telehealth rooms. So basically you scroll down, it has just some general information about who we partnered with. I need to add in here that we've expanded. I'm going to note that. But yeah, so we have 5 locations called telesuites. You know, why would you want to use it? A picture of our telehealth, one of our telehealth rooms is an example. And then down here we have just some like general icons as well, which that are clickable, and I will go into that in a minute. And then our collaborating organization. So this is basically, like I said, this is the group that started it all, but we've since expanded. So I have here a little, if you click on telesuite locations, I have a little map here that has all the locations and their hours, and then links to their websites as well. So that's that page. I'll go into the reservation form last. So that would be this icon. These are just some telehealth resources that we had created. So we worked with Catch a Fire. I don't know if you guys are familiar with Catch a Fire, but we worked with Catch a Fire to create these videos. And basically, there's one for patients, so what they can expect during a telehealth appointment at a telesuite, and then one for providers as well. So how to maximize the quality of care given during a telehealth session. And we did have our our partnering organizations providers watch the video about how to maximize the quality of care with a telehealth session. So we have those on our website. We have policies for each of the locations as well. These are just, you know, general policies. You know, make sure you are not running a fever when you come in, that the library or telehealth location is not a babysitter, basically some things like that. And then some general troubleshooting. So I collected information from our provider organizations on like the modality of telehealth that they give out. So it's like either Zoom or DoxyMe or secure video. And these are just some troubleshooting on each of those kind of platforms. I also gave all of the locations a little binder that has some basic troubleshooting in it, and like steps to get on their telehealth session, things like that. There's some frequently asked questions as well. You know, so what is the telesuite? What will it cost? Will it actually be private? How do you book a time slot for the telesuite? Or why would you use the telesuite? So just some general little clickable frequently asked questions, and then the actual reserve of a telesuite. So this is a form that I created. Let's see here if it's gonna load. There we go. Okay, so this is a form that somebody would fill out if they would like to reserve a telehealth room at any of our 5 locations. So just some general information, just in case we need to contact them in case the telesuite location is closed for, emergency purposes or anything like that. And then they can choose to specify the organization they're with, or they don't have to. There's another option, and then they're able to pick which telesuite location they would want to go to. And when they click a location, it automatically populates the available time slots, and they are 1-hour time slots. That's kind of what we deemed to be the general length of a session or an appointment. And if it would fall in the half hour, they would just reserve 2 time slots that is available. So we've been trying to keep these out at least 2 months, and I think right now this is out 3 months. So that's fantastic. So yeah, so they would just pick a time slot. They could write a comment or a message if they have any like accommodations that they need or anything like that, and then they would put their electronic signature to say that they agreed to the terms and conditions for the policies for the location. So yeah, and then they would submit it, and then they would get an email, and we would also get an email notification that it's reserved for this day and time. So yeah, and then they're able to click here to if they would like to reserve or make an appointment with any of our partnering organizations. Sorry. So yeah, that's kind of the gist of our website and our kind of what we've got going on. I'm going to go right back into this.
So thank you, Jordan. I'm going to open it up to questions, and I have a question.
Yes, absolutely.
If a library patron chose not to use a computer to register and they called to register for an appointment at a library, would it basically work the same way? I'm just assuming that somebody on your end would just be registering them on a
Yeah,
computer for them. Okay.
Yep.
My other question is the registration on your website, is that a particular, like, what did you use to come up with that registration? Is it just built into your website, or is it
So yeah, that's a good question. So it's a platform called Airtable. So basically it's similar to Excel. And you can build forms off of it, and then the information is put
what was it
into
called?
a spreadsheet. Airtable.
Airtable.
There are probably better ways to do that, I will say. But that's something we already had in our organization. So
Okay.
we didn't have to pay for another subscription or anything like that. So yeah.
And so there's somebody on your end that's dedicated to checking, dedicated to getting these emails. Maybe it's you, I don't know.
Yeah, yep. And they're also forwarded to the our
But
telesuite location. So for example, we have Mary on here. Mary's from the Randolph Library. So if somebody were to reserve on the online reservation form an appointment for tomorrow at like, I don't know, it has to be in 24 hours advance. So tomorrow it will say like noon. I would get the email, and the email would be automatically forwarded to Mary to notify her. She also has access to a spreadsheet that would have all of the reserved time slots as well. That could be checked daily if she would like. Or like I said, there would be an email sent.
I have a question for Mary, since we have an STLS person with us. s- Um, it went out of my head. I hate it when this happens. It's the danger of getting older. It'll have to come back later. Maybe somebody else has a question, and then when my question comes back, I'll ask it.
Yeah, that's good. Does anyone else have any questions for me?
Oh, I remembered my question. Do you have a link to their website on your library website so that to create awareness? And if you do, like, are people clicking on it?
I do, and I have to be honest with you, I'm not the greatest at managing my own website. I do it through our library system. I don't honestly know how much it's been used to tell you the absolute truth about that. So
Okay, but
I need
thank
to get
you.
better at that. So
It's okay. We're all busy people.
I definitely think that would be helpful though, if like any of the other libraries do that. To kind of have a clickable thing on their website, just to kind of, like you said, drive awareness that it is available for their patrons and stuff.
Yeah, I was just curious because it just was an idea I had that if,
Yeah.
does anybody else have any questions? Or if you're shy, you can go ahead and put it in the chat room. I'm happy to read any questions out loud as well.
The reservation form too is HIPAA compliant. I know some of that's a little confusing, but we do have HIPAA compliance officers at our partnering organizations that ensure that it is HIPAA compliant. So just a little tidbit.
Yeah. Well, I am going to move along to
Okay.
Charles, who is from the University of Rochester Medical Center. He's going to talk a little bit today about some of the funding opportunities available to libraries in the URMC region. It's kind of exciting, and it could help to increase usage of the services we have. So, Charles, I'll leave the floor to you.
Thank you. That was a great presentation, Jordan. That's really inspiring to see how well integrated this system is for libraries. So that's great. Just a little bit about me. I'm a clinical psychologist by training, and I'm here as a researcher in the Department of Surgery at the University of Rochester. I'm also the Assistant Director for Community Outreach and Engagement. And in that role, I have started working with Stacy on a project to enhance usage of the telehealth booth at the Massillon Library. I am filling in for Sarah Merritt, who is our outreach strategist for our office. And so I'm not sure I can tell you too much about like general funding opportunities, but I don't know, Stacy, how much has this group heard about our office and about the opportunities we have to work with?
I don't think a lot. So if you want to focus on that, that's all good information too.
Yeah, I'll talk about that, and Michelle, who's on here, definitely has heard this before since she's part of our group. I'll go through this quickly, and then we can discuss how we might be able to work with you. Oh, but I do need access to screen sharing if I'm gonna share any slides.
It should be good now.
Awesome, thank you. All right, can you see that?
Yes.
Great. All right, so our Community Outreach and Engagement Office is baked into the Wilmot Cancer Institute, and this is part of our effort, which has been going on for the past 5 years, to achieve National Cancer Institute designation status. And as part of designating a cancer center, the National Cancer Institute says that that center has to serve a particular geographic region through community outreach and engagement, which is great. We've moved away from just like providing cancer treatment and doing basic cancer research to really thinking about the communities that we are trying to serve. So this was a picture from 2022 of our retreat and all of our community partners that we've worked with over the past couple of years. So here's the leadership team for this office. I'm one of the assistant directors, along with Francisco Cortejano, who's the other assistant director, and Paula Cupertino is our associate director heading the office. I won't go through this in too much detail. I think the relevant piece here is that we really have the community as a guiding part of all of the work that we do. So our Community Cancer Action Council, of which Michelle Foster is a member, reports directly to the director of the whole cancer center and advises him on community priorities, as well as to our office. And then we have a number of staff members, including Sarah Merritt, who has been on this call before, I believe, who coordinates all of our outreach staff to do projects like working with telehealth in libraries. We have 4 aims. I'm not going to go through these in too much detail, but the first aim is to use data to understand the burden of cancer in our catchment area. And the catchment area is just the geographic region that our center serves. The second aim is to work with communities to develop powerful partnerships that can address that cancer burden. The third aim is to help the cancer center to have research that really reflects community priorities. So a portfolio of studies that can hopefully reduce the burden of cancer in our region. And the fourth aim is to do outreach and deliver programs to communities in our catchment area. We have a super cool mapping program that pulls in a bunch of different data from a bunch of different sources and puts it on a map in real time. And this program has won a bunch of awards. It's called Canvas. And the coolest thing about this is we can get medical record data from our medical record and put it directly onto a map so we can see where patients are coming from and how they're doing over time. We have a 27 county catchment area. So I think, Jordan, we overlap in one county with you. It's a pretty big region, and we partnered really closely with Bassett Medical Center out in Cooperstown to better serve this eastern part of the catchment area. But most of our focus is in the Finger Lakes region. And just so you know, as a factoid, our cancer burden in this catchment area is incredibly high. In fact, if you were to take those 27 counties I just showed you and make them their own state, they would have the second highest cancer burden of any state in the country, second only to Kentucky. So there's a lot of cancer in this region, and we don't exactly know why. Every time I present these data, people are like, why is there so much cancer in this particular area? And we don't know exactly why. But you can see that it's been true for the past 30 years that incidence of cancer, so new cases of cancer, have been higher than both the state and the country, and also mortality from cancer has been higher. And it's a little alarming that we're seeing an uptick in cancer incidence in this region when most places are seeing a downturn. And again, this is it just, for me, reinforces why we need more cancer research and more cancer programs in this area. I'm going to skip over this for right now and just say, so this is our Community Cancer Action Council. And this is actually the way in which we became involved with Stacy. Our Community Cancer Action Council has 29 community partners who sit on it. It's led by 2 co-chairs, and it has 4 working groups. Each working group can have a project each year, and the Cancer Center will fund that group to do the project that they've proposed. And we've done some really cool things, like the Community Engaged Research Group down here at the bottom, led by Don Armstrong and Alyssa De Jesus has created a clinical trials video, which is now being delivered to all of our cancer care locations across our catchment area to teach people about clinical trials and to help to encourage them to be part of a clinical trial. But most relevant to this group, our Access to Care and Rural Integration Group, which is led by Jason Coleman and Michelle Foster, who's on this call. That group has focused on telehealth as a way to improve access to care. And we've done a number of different things to try to assess the access to telehealth in our region. So we did first a survey, and Stacey, if you've talked about this, stop me because I don't want to go through anything that's too redundant.
It's good. Keep going.
Okay. All right. So first we did a survey where we surveyed 73 libraries from across New York State. Probably some of you got our survey back in the day. This was 2021, I want to say, maybe early 22. And we basically asked libraries, how do you feel about telehealth? Would you have the capacity to host a telehealth booth? What concerns do you have about hosting telehealth in your library, and what facilitators, what resources do you have that could make it possible? And I'll back up a second to say this was really based on Diane Connery, if you've heard of her work in Texas. She, at the beginning of the COVID-19 pandemic, set up a telehealth room in her library that looked actually very similar to the rooms that Jordan was showing. And her library was in a super rural town in Texas, and that allowed people to come to the library, go to the telehealth booth, and have appointments. So based on that, we conducted the survey, surveyed 73 libraries. Stacy responded to the survey and said, actually, we just got a grant to build a telehealth booth. And so we're like, oh, amazing, an amazing happenstance. So we started partnering with Stacy. We did a survey of the Macedon community about their perspectives on telehealth. And we also talked to the library staff about their readiness to implement telehealth. And that was great. We've presented those findings at a couple of conferences, and we're working on a manuscript based on them now. But we really want to take this project to the next level. And the good news in terms of funding is that I'll just say, I don't know if you've shown your booth, but we do have a little picture, oops, of somebody in the booth at Macedon Library as part of this work. So I'll stop sharing and just say that in terms of funding opportunities, what we have is the access to care group is given a budget, and Michelle, you can speak to this probably better than I can. And one of the things that was discussed is bare minimum, if all of you have telehealth booths that you want to promote access to, we can certainly use some of that funding to help create pull-up banners, flyers, promotional materials that you could keep in your library to make it clear, like, here's what we have, here's what we're doing. Michelle, you can pipe up if I'm saying anything.
No, that's it. I think we have about $5,000 to
$5,000.
spend on that. And then we also thought about bookmarks because it's a way to, I mean, people love bookmarks, but it's also a way for them to leave the libraries and get out into the communities. So have little promo about that.
Yeah, and he would be not just to put them on the counter, but to encourage staff to actually put the bookmark in any book as it's being checked out. So we know they get it.
And our job as the staff of the COE office is to help to bring these visions to life. So it's great to talk to you all because we'd love to hear what would be most beneficial to you. And we can then take that back to our PR and marketing teams here and help to create pull-up banners or bookmarks or rack cards that make the most sense for your area. The only other thing that I want to add is that we also work pretty closely with the physician liaison group at University of Rochester, and we do cover probably a lot of the counties that you all are working in. George Lambrix, who is a physician liaison for the Finger Lakes and Southern Tier, was just telling us, did you talk about this already, Stacy? Sorry if I'm repeating it.
No, I don't think so.
Okay, so starting last month, the University of Rochester developed these telehealth kits that include blood pressure cuffs, scales, and other tools, and they were delivering those to banks. So 4 banks, 1 in Seneca County, and then 3 in Steuben County received these telehealth kits. And the goal was to set up essentially, much like we were talking about with the libraries, these telehealth pods where people could go to the bank and they could have an on-demand appointment with a provider from the University of Rochester who's standing by, ready to do basically kind of primary care type things. But unlike a lot of these similar setups, the provider would be in our region. So like if you needed follow-up care, you could come right back to the University of Rochester to get follow-up care. And I can't speak for George and the physician liaison group, but I think there is a possibility if people are still wondering about getting telehealth tools to their library, of partnering with that group to get one of these kits installed at your library. And I guess I actually have a question for Jordan. With that setup that you have with the computers, do you have biomonitoring devices too?
No, and I was just about to ask you, can you tell me what the name of that organization was again?
Yeah, so it's part of the University of Rochester Medical Center. It's the physician liaison group. The contact is George Lambrix, Lambrix. And
I have his card. If you need his contact, I can
Yeah, that would be
email
great.
you.
Yes, please do that. Thank you.
And Pivotal represents 8 rural public health departments in the Finger Lakes and our rural counties. And we put telehealth equipment with those add-ons in each public health department for utilization. So there's an otoscope and whatever, all those things. And then also have the equipment for nurses to be able to take out if they do a home visit.
yeah, I think it's super great that you have that, Michelle. We have this capacity. The things I don't know, because I'm not, and maybe you know this, Michelle, how much are the biometric monitoring devices linked up to the internet so that you can immediately transmit any like blood pressure findings to a provider?
I don't know that because we just put them in, and I'm trying to promote using that equipment in our public health departments too.
Yeah, and we're just starting ours too, so I'm not sure about the integration. That's something for us to maybe explore, and we can come back and report to you all,
Yeah.
because Diane Connery, one of the things that she had was a platform where people could take their blood pressure and it would get transmitted right to the provider on the other end, which was very useful. So you could see how people were doing in terms of their vital status. But yeah, we'd love to partner with you more. And also if there's more that we can do as an office to support any cancer prevention efforts within your libraries, we are happy to come give talks, provide materials. One of our big focuses is on smoking cessation. Our smoking rates are very high in this region, and also lung cancer screening, because lung cancer, I don't think I had the graph up there. Our cancer burden is really high in the region as a whole. When you look at our lung cancer burden, it is extremely elevated compared to the state and the country. And maybe that's because of smoking. People always wonder if it's because of Kodak and industrial pollutants. We don't know. But because of that, we really want to promote lung cancer screening. And that's something that would be easy to do in a telehealth situation, because everyone going through lung cancer screening should have a shared decision-making visit first with a provider so they understand what the screening involves, and that could easily be done via telehealth. So yeah, I'm happy to answer any questions or hear any thoughts you have about other ways we could partner with you all.
So I'll jump in. I'm Kelly Pavra. I'm the director at the Watkins Glen Library in Schuyler County, New York.
Oh yeah.
So thank both of you for your presentations today. It was really helpful. So we have one of the telehealth kits. Obviously, we've talked about this a lot, about struggling to get it out. I did put some feedback on Jason's Jamboard, and I'll continue to kind of do that as things come to me. I really love the idea of bookmarks and more marketing materials. I think that's something like we did. I mentioned this at our last meeting. We just finished our strategic planning and we did a survey last year. And I issued out bookmarks with a QR code, and we had, over 200 responses, which for our small town is very high. So I think that's a really great way, like Stacy said, to get that information out into the community. So I super support that idea. What else did I want to say? I think I had added it. Oh, so one thought I had is maybe creating a drive or some kind of shared space with like how-to information, or just something, or a LibGuide if any of the libraries have access to LibGuides, just one area where we could all access some of the relevant information, documents for the medical charts, anything like that that we think might be helpful, would just make it easier for staff, I think, to help find that stuff.
Yeah, that's a good idea.
Do any of you know, and maybe Jordan, you know this, is there like an SOP, like a standard operating procedure guide for setting up these kind of telehealth facilities?
Are you talking like setting up a telehealth room, or like how somebody would join a telehealth session?
No, actually setting up the telehealth room.
No, I've not seen that,
I haven't
but
seen.
maybe there's something out there.
And that would be like something great, I think, especially if you have libraries that, like we mentioned, a lot of people we're all busy. So it's nice if you have something to work from. Even, yeah, just something basic like that. Like, here are some ways you can implement telehealth in your library or in your institution. Here are some great resources. Here's some links. Just having all that information in one spot, I think, is a great tool for us to use moving forward.
Yeah, absolutely. Just to kind of piggyback on what you're talking about, Kelly. I was initially presented with this project to kind of take it over. I like reached out to organizations that, like, I did just a basic Google search of organizations that put in telehealth rooms. And there was one in Texas that I actually called and like got information from her, like specifically how she implemented it, what kind of things she like used, like was it a telehealth like hub, a telehealth room, or was it just like equipment? So that's kind of the way, but it would have been nice to have something that was like already implemented, like a guide, like here's how you set this up, basically.
Was that Diane Connery, Jordan?
I think it was.
Yeah.
I think it was, it's like the Pottsboro Library,
Yes,
I
that's
believe.
her. Mhm.
Yeah.
Yes. So I reached out to her. I'm sure she gets that a lot because obviously this is a kind of a hot topic right now of getting telehealth in rural areas. But yeah, so I reached out to her and got some information from her. So
I also think I love the idea of the biomonitoring tools. I think like we're developing a library of things, which is now very popular. And thinking of what types of items would we want to have available for patrons to check out. So even if it wasn't a part of our telehealth kit, that might be something that I like personally would think of investing in. Maybe like a biomonitoring kit, different devices that would be recommended by U of R. And just say like, hey, you can borrow this. You can also check out the telehealth kit. That might be more enticing for people too. So thank you for sharing that.
Mhm.
Yeah, happy to share that, and happy to if you can't find George or whatever, happy to connect you. I do want to mention one other thing in terms of if you're hoping to have some healthcare type event at your library. We do, as of last month, have a mobile mammography van at University of Rochester as well. RRH also has one, so you have options, but we are thinking through the 2024 schedule of events. And so if you wanted to host a screening day or some health promotion fair at your library, we will drive that van out to you. We can have the screening event set up, and we can also bring other resources like health information, tabling, and we also have a really strong partnership with the New York State Cancer Services Program with the Finger Lakes. So if people come to your library who are un or underinsured, we can still provide a screening to them through that program.
I have a thought regarding promotion. I know in our area we have the RTS buses, and if there could be like a banner or some kind of advertising on the side of the bus about telehealth, I wonder if that would maybe help a little bit to increase awareness.
Yeah, I know back
And
in the day.
I don't know about the other areas if you have like a rural transit system, but that could be a thought.
No, I think that's a great idea. We have like the Olean Area Transit System, OATS is the acronym. And putting something on there would be fantastic.
I think back in the day we made little ad inserts for the inside of the bus, but it is way more impactful to have it on the side of the bus, like a mobile billboard driving around. That's a
Right.
great to ask our marketing team about.
Yeah, that could impact even the city too, because, they're also there. And another thought I had is some kind of sign that could go on our, well, I know not every library, like my library is on a busy road. It's on 31, which is pretty busy corridor. So if we had a sign on that corridor, I mean, a lot of eyeballs would be on it, which would increase, awareness, hopefully. So I'm just thinking for libraries that have that sort of situation, maybe some kind of, whether it's a sandwich board or something that's you stab into the ground and I don't know, that could be, maybe useful. And I love those little movies, the Catch a Fire movies that Jordan has on her website, that kind of thing is so nice, and it's so easy to promote to patrons and easily understood. Like, I love that.
I just
No,
popped.
$5,000 can't cover all the ideas.
I know,
Just
I was thinking
brainstorming.
billboards have a huge, we've done billboards for opioid and recovery projects that we've had and put them in each county of our counties. And they're seen by a lot of people. And if you pay, we've paid for a month or 2 months sometimes, but if there's nothing that goes up on the next, like is paid for, they stay up for a lot longer.
Hmm.
They'll stay up as long as until the next person or organization puts a billboard there. And they're not super cheap, but there's a huge bang for the buck. And we also have metrics around how many people see them. So we get numbers tied to eyes on the board by the companies. We've used Park and Lamar because those are the two in our catchment area. So mostly to Charles, like maybe that's a thought down the road.
Yeah, I'm collating all these suggestions, and we can take it back to Allison Mundorf and see how far can the $5,000 stretch? But it sounds like the bookmarks are something that everybody would be interested in, bare minimum. Okay, great.
I totally agree with that. If the librarians do, directors do too.
Yeah.
The bookmarks are nice too, because like when I did strategic planning, I was able to take some over to like the Chamber of Commerce, distribute them to the other libraries. Different organizations were willing to have them on their desks. So you just never really know how many people you're reaching when you have something as small as that can be just about anywhere.
Mm-hmm.
And it's nice to drink. But yeah. Morning.
Charles, can I just clarify that, would you be willing to come with Cattaraugus and Chautauqua County being outside of your area? Would you be willing to would you be able to come to our area for some kind of a program?
Yes, actually, we have a care location in Cattaraugus County. And the only reason we don't say that's part of our catchment area is because Roswell Park is right now the only National Cancer Institute designated cancer center in upstate New York. And Cattaraugus is one of their counties. So as to remain friends, we don't claim that as part of our region, but we have a care location there. So absolutely, we would come out there to give a talk.
Mary, I think that would be a great opportunity to kind of, make it aware that the library is a place for healthcare as well. And to kind of tie that into the telehealth room and kind of promote that as well. So if you did do something like that, maybe we could create some sort of promotional material to either hand out, or you could, while people are there, show them the room and the equipment for the telehealth. Something like that, I think would be fantastic.
I totally agree.
I have another kind of random idea, but maybe for planning for the future, our cohort could kind of pick, say like Breast Cancer Awareness Month, or something that has like a month that we're already doing book displays and things for it, and really do a push, maybe pick that month as like, we're all going to do a program. Something like that I think would be kind of fun and give us some like accountability. I know I need that sometimes to make sure I'm on top of stuff, but I think that would be a great way to kind of get our mission and get more of that telehealth information out there. And I'll add that to the Jam board so I don't forget.
And this is the Jamboard Jason Coleman started. Yeah, great, perfect. Yes, any thoughts, put that up there because that'll come back to us too.
Yeah, definitely use the Jamboard. They will be looking at that. And my apologies if you tried to use the Jamboard and had any difficulty. That has been fixed. So look again. If you did try and couldn't do it, go there again because it does work now. A setting had to be changed. Well, we have 10 more minutes before we wrap up, or if there are no more comments or questions or anything anybody wants to talk about at all, I can shut us down now. But I just want to make sure everybody has had a chance to have an opportunity to share their ideas and thoughts. I definitely want to thank Jordan and Charles for all the information they shared today. And I know I have lots more ideas now. So I feel like this was a great meeting. And we will be in touch with everyone with the date for the next meeting. That has not been set up yet, but I feel like it'll probably be roughly the third week of January. But I have to wait and see what Charles' schedule looks like. So
Yeah, and I just put my email in the chat, so feel free to reach out if you have any other thoughts. You can also reach out to Sarah Merritt, who's on this call sometimes, or go through Stacy. Any of those will work. But yeah, it was great to meet
I
everybody.
said Charles. I meant Jason. I'm looking at you, so I say Charles. Anyway, I meant Jason Coleman. He couldn't be here today, but he does like to be at these forums.
Yeah, thank you all so much.
Yeah, and
Thank
if anyone has any questions as well, I popped my email in the chat too. Feel free to reach out with me or reach out to me with any questions you may have.
Oh, and one more thing, don't be afraid to tell your colleagues about this forum. We are welcoming other members who, even if they don't have any telehealth stuff yet, that's okay, because they might come to a meeting and decide they want to try it out. So please.
I did mention this at the last Directors Advisory Council meeting. It's been a crazy 2 weeks. I did not share out the link early enough, so I'm definitely gonna share out the January link once we
Awesome.
have the date, so.
Okay, thank you.
Stacy,
Thanks,
I was
Kelly.
gonna say too, we should try to get that out to the RRLC listserv. I think we
Okay.
neglected to do that for this one, but
Oh.
let's do that for future ones and then
Sure,
I'm sure we can add to the group here.
okay. Will do. Well, I think with that, I'm gonna shut us down and I hope everybody has a nice weekend. Bye.
Thank you.
Next time.
Bye, thank
much.
you.
Bye.
Take care.